I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsey Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsey Vestal. I will link to the group below in the show notes and description. Thank you so much.
Happy Wednesday, everyone. I am on a roll this week because I've had this amazing privilege to be able to speak to several of the amazing people who will be presenting labs at the upcoming OTs and Pelvic Health Summit. Yesterday, we had a chance to talk with Lynn Schulte and Erica Stevens. Their labs blew me away, and I got to tell you, I am so excited to welcome Sujata Martin here to be talking about energetic treatment of the pelvis, which is one of the labs that will be offered at the OTs and Pelvic Health Summit this August 17th and 18th. Sujata, thank you so much for being here and for being someone who's going to be presenting such an amazing lab at our upcoming summit.
Thank you, Lindsay. I am so excited. Just being in the company of so many wonderful, forward-thinking OTs, but B, just bringing this topic to this audience that is so curious and so eager to learn. Just because I feel like no one is talking about this, that is such an important part of our work. So
I
excited to be here.
I couldn't agree with you more, Sujata. And I personally am so excited to meet you. I feel like we've known each other virtually for
Yes.
years. And so, it's like this big reunion of people that we've known each other for some of us years and years, and to get together and to just feel that energy in the room. Sujata, I would love to just give a little bit of background about you so that for those of us who don't know you as well as I do, can kind of join in the conversation. So, Sujata, you have a background in pelvic health as well as a yoga educator,
Mhm.
and you provide educational and informational programming to universities,
Mhm.
nonprofits, physician groups, and the general community, all with the goal of really increasing awareness
Mhm.
of access and to integrative pelvic health care. And that is really where you shine, Sujata. I've had the pleasure of having you on an OT Empower Hour in the past, and just blown away with your reflections and just the depth of which you consider pelvic health topics. You also own a private practice in Tampa Bay, which provides integrative pelvic care to all people. So, Sujata, tell us a little bit more about your lab that you'll be offering at the summit.
Okay, I am so excited because honestly, I thought the topic could be perceived as a little out there by some folks, but knowing Lindsay and how you are so expansive in your view and you are so integrative in your practice, I am so excited we are bringing this topic to this audience, which is energetic treatment of the pelvis. So to kind of simplify it, I'm sure any pelvic health practitioner who is doing trauma-informed, client-centered work for even longer than 6 months has heard something along these lines. I'm tingling all over, or oh my gosh, I feel like things are finally flowing, or I feel my pelvis feeling warm, or I feel that going down my legs. This is feedback we often hear from clients. For some of us, again, who practice in a certain specific way where we are more connected to our energetic beings and that of our clients, we may even experience things like some clients expecting like trembling, or suddenly they are cold or warm, or they get very emotional. So all of these are basically energetic or emotional responses to the treatment of the muscle of the fascia. And I think it is so vital that as client centered, trauma informed practitioners, we should know how to handle that in a safe and resolutory way. Meaning, in the beginning of my career, when this began happening, I had two patients just jump out at me where that release kind of happened or that response happened. and it completely threw them off. They went from being very regulated to what just happened. And that happened because, again, and I think it was not a good or a healing experience for them because it was too close to whatever their triggering event was, which caused them to be in pelvic dysfunction. So my hope is through this talk, and it's only an hour and a half, honestly, we could, and in fact, it is going to be a whole course, but I could talk about it for like 6 hours, 12 hours. But I'm hoping this will be a nice taster and people get takeaways where they can handle those emotional or energetic discharges, creating safety for the client. So the client is not alarmed by why am I trembling? Why am I cold? Why am I suddenly sobbing? That we have ways through our words, through our touch, through our truest like therapeutic use of self to make that a healing experience versus a dysregulating experience for the person we are working with.
I think that is so important, Sujata. And I feel like these are the topics that we don't discuss enough, and perhaps there's a little bit of embarrassment or even shame that might happen as a practitioner when we're in these experiences, because here we are trying to hold space, trying to help them on their healing journey. And unfortunately, it may have not happened in that way. And so you're bringing up layers of taboo conversations that already are in a taboo world, which is pelvic health. So thank you for doing that, because I do really believe that the more trauma informed we can be, and the more that we can really be able to regulate not only our own nervous system but help facilitate that for our clients, it's the wave of the future for pelvic health. So I am really excited about this. Sujata, can you give us just like a little small nugget, just to give us a sense of what we'll be doing with you in the lab?
Sure. So, as much as I love being integrative, which I do, I like to be evidence-based because at the end of the day, realize we are professionals, a lot of us working in medical settings. So we don't want to confuse our role with, say, an energetic healer, a breathwork practitioner. Some of us may be having those skills, but we want the general medical community and of course our client, this is still evidence-based work we are doing, which is why I am drawing on the work of scholars in, again, the Western sciences of somatic psychotherapy, meaning a lot of us may be familiar with the work of like Bessel for example, where Body Keeps the Score. That is a classic text on somatic psychotherapy where he talks about how through the body we can treat the mind. Similarly, the sciences of yoga and tantra have been doing this work for centuries. There are texts with verses on how to get into these states, integrate these states, explain these emotional responses. So I will be, during our course, using evidence both from the Western sciences of psychotherapy, somatic psychotherapy, as well as from texts in yoga and tantra, pulling these resources that us practitioners and the attendees can use, meaning specific breathwork practices, specific mindfulness and visual imagery practices, even exercises with sensate focus, where the client is using self-touch or self-regulation or imagery or vocalization, where they can again make these energetic or emotional responses regulating versus dysregulating. So again, we'll be starting off the lab with just giving attendees a background on where this information is drawn from, in that this is not just something I cooked up. There are very valid sources who have been documenting and discussing the importance of, the energetic, the emotional responses of our body. So understanding where to draw that from, and also giving a very brief overview of very easy therapeutic techniques like therapeutic use of self techniques, meaning where you would position yourself on with a client. For example, if we have a client who, when you're working on them, whether standing or sitting by their bedside or table side, and they start having uncomfortable or initially uncomfortable response where they start crying completely unexpectedly. So doing simple things, and we'll be simulating. So it's a lab which will help us, give us the chance of switching off. It's only 90 minutes. We'll do our best of switching off roles between client and practitioner, and how we can use things like the softness of one's voice, or how we can use our breath to help our client regulate with cues like, okay, you're okay, and breathe with me, and because sometimes people start hyperventilating, with the like that kind of breath pattern. So helping them find their way into regulation, using cues like, again, tone of voice, pattern of breath. Maybe you use gentle, firm pressure on their shoulder blades. So it's not on their torso, it's not near places that may have caused trauma in the past, but something that is just gentle and on the shoulder blades and downwards towards the table, so they feel grounded, versus because some people start shaking. So just those overviews of breath based, vocal cue based, and physical cue based strategies that someone can use to create that regulating experience versus a dysregulating experience is what I'm hoping to cover. There's just, again, so much we could do, but that is the basic of what I'm hoping to cover in the lab.
Sujata, that just sounds phenomenal. I am so excited about this. And I have to tell you, last year we only offered 60-minute labs. And the feedback that we got was like, we want longer, we want more. And so, yes, now this year our labs are 90 minutes, which I think will just give us a chance to dive in even more. So thank you. Thank you so much.
Yeah.
I'm so excited to meet you in person. I'm so excited to see everyone who will be joining us August 17th and 18th in Phoenix, Arizona. I will put the link to get on the communication list in the comments. Tickets go on sale in February, and we sold out last year, Sujata. So I anticipate the same will happen this year. So I encourage everyone to grab their tickets, and I can't wait to see you then.
Likewise. Thank you. Thank you. Thank you so much, Lindsey. I can't wait. I'm so glad we did this. And I'm so glad we get to do it in detail in person in Arizona soon. Not so far away.
Awesome. Have a great day, everyone. Thank you, Sujata.